maybe the dose is also what's helpful if they can take 1 gram a day. But combined with other things, it's more effective. Alone, not very clinically effective, apparently. Estrogen vaginal cream in postmenopausal women definitely can help to reduce recurrent UTIs. Again, it's not foolproof, 100% cure, but layered with many things that are non-antibiotic algorithms, it's going to be much higher. So a tiny study, 47 patients, they looked at 6 months of probiotic use, D-mannose, and cranberry, and they saw a reduced rate of UTIs by 76%. And these recurrent UTI cases dropped their antibiotic 90% of the time. So using multi-pronged approach is best. So what I suggest and have clients consider when they're doing a regenerative protocol is to do our standard, gut healing, but then add in some really cool peptides because they are targeting the terrain, right? All kinds of healing and regeneration. When a bladder gets affected with invasive bacteria and yeast, it's like pretty gnarly, really not comfortable at all. So I do a very similar protocol with as with our gut protocols and the PV and candidiasis protocols. So for an acute UTI, still consider the gut, taking oral probiotics for women, even using a vaginal probiotic intravaginally, because the vagina area definitely communicates with the bladder, the terrain. They're all connected. So generally, actually, what's in the bladder is in the vagina, as the studies I shared earlier with the core biome shared between these 3 sites: gut, vagina, and bladder. So for women, vaginal insertion is really great using like Microbiome Mojo or Bifimaximus or any other great probiotic that they like and they tolerate. I have people kind of avoid strep. As you saw, there's a lot of strep as a uropathogen. And if someone is developing autoimmunity, they're going to develop an antibody to strep. And unless you want to get really expensive, you can check anti-strep antibodies, but I just try to be on the safe side and not introduce that in as a probiotic. It's not really a probiotic. It's found in food. It's not found in humans. Streptococcus thermophilus is absolutely a food industry probiotic. It's not seen in the human microbiome at all. So we kind of avoid it entirely. So no VSL number 3, no, cheap probiotics. You have to avoid certain yogurts. They've started to sterilize yogurts, and then they introduce a known food industry probiotic like Strep thermophilus. So now a lot of fermented foods on the shelf don't have the native fermentation profiles. They actually have put in Streptococcus thermophilus, and you're getting a pretty high dose too. So kind of look at food sources too. They can be triggers, I think, for people. So in humans, we can get a PANDAS condition and that leads to, anxiety, depression, personality changes, and at worst, like schizophrenia and bipolar. So we don't want to induce strep problems there. So other things we want is I have people consider, if they're pretty symptomatic, 1 to 4 grams of the over-the-counter methionine for whatever days it might take. If the symptoms start to go away after a day or two, completely no symptoms, they can consider stopping it at that point. If they have really terrible pain, they can use phenazopyridine, really, safe analgesic for the bladder, but they can't and should consider not using it more than a few days because it will start to block and mask if there's actually a therapy failure. So it's hard to know because it's such a good analgesic. And of course, if they are open to it, not everyone gets a UTI. We saw that there are a lot of risk factors and the epidemiology that leads to this. But anyone that gets such a severe infection probably has other dysbiotic areas going on. So I always think it's good to, if they're willing, to go look at other things going on, like a gut test or GI map test, or even preferably an oat kit. If someone's pretty symptomatic and they're kind of having recurrent issues, then it's really good to consider some Chinese medicine. But if it's a pretty uncomplicated picture, usually over-the-counter methionine is all that's needed. And for recurrent UTI, again, it's a really similar protocol, but we dig a little deeper. We pull an oat and consider how to address the oat. Is the fungal profile much worse and larger than the CFO protocol? If so, I do 2 antifungal agents and then 1, SIBO parasite protocol. Again, parasite protocols are antibacterial, so they really will address a lot of the uropathogens very simply, and we'll use it twice a day. I like to go to lower dose if possible, but we do a week or 2 on, and then 5 to 7 days off, and then do another cycle of that. And then depending on how deep the dysbiosis is on GI map or OAT, how many red zones, I kind of count up the red zones.